Hi, Mr. Bookman.
Hi.
It's nice to meet you. My name's Matt. How you doing today?
I'm okay.
Okay. My role here is a student social worker, so I do have a supervisor at this agency that reviews my work. I just wanted to make sure you're aware of that before we begin.
Okay.
You have any questions about that?
No.
Okay. Have you ever been in therapy before?
No.
Okay. So there are a couple things that we should discuss before we get into why you're here today. Um, Everything that you say in this therapy session is confidential. There are a few exceptions to that. The first one is if you tell me that you feel like hurting yourself or killing yourself, I am obligated to report that. The second is if you tell me you feel like hurting someone else or killing someone else, I have to report that. And then the last thing would be if you tell me about any abuse or neglect that's going on in your family, then I am also obligated to report that.
Okay.
Do you have any questions about that?
No.
Okay. It's really important that you feel safe to tell me as much as you want to tell me in this session.
Okay.
So that is my utmost priority, is your safety. And if that means I have to break confidentiality to do that, then I will. Okay?
Okay.
Okay. So why don't we start by talking about why you're here today?
Well, my girlfriend gave birth about 2 weeks ago to a baby boy named Eric. And he is currently in the NICU because while she was pregnant, she was using drugs and he was born addicted to opioids and methadone. She has a history of drug use, and I knew that when we got together. And when she found out she was pregnant, she started going to a methadone clinic, and I thought we were doing really well, kind of working together.
Yeah.
Obviously, she was not doing as well as she was letting on. He was born addicted to opioids and methadone. She was also using weed. So she lost custody of him and her other 3 children that she has with her ex. And she can't live at home with us. And it's just really hard because I'm like, I have a lot of anger, a lot of pain
Yeah.
from the betrayal. And then I'm just really afraid of how I'm going to raise a baby by myself now because I don't even know if I want her in my life. I just lost my job, so I don't know how I'm going to support us. Yeah, it's just really hard. Her ex is in jail. He attacked me about 5 months ago. Just out of the blue, decided to start beating the crap out of me.
He attacked you.
He did, yeah.
Okay.
But he's in jail for I don't even know how long this time. So yeah, so it's been my life for the past 2 weeks.
Okay, so you've got a lot going on your plate right now.
Yeah.
Okay. Wow. So I can imagine that you are pretty blindsided by some of these things that have surfaced in the last couple of weeks.
Yeah, I thought we were doing okay. Thought things were okay.
How does that make you feel when you think about what's happened?
It's a lot. I'm hurt, I'm angry, just kind of sad, a lot, scared. I don't know what I'm gonna do. I'm sad because like I do love her, but she lied, and I don't know if I want to try to make it work, especially now that I have a son I need to look out for.
Yeah.
And I don't mean this to sound crappy, but God knows what that's gonna look like, kids who are born addicted to drugs generally have some issues. Her other kids don't, luckily. But I don't know if the same's gonna go for Eric. So I don't know what that's gonna look like being a parent for a kid who may have some special needs. I don't know if I'm gonna be able to handle them.
Okay, that's a pretty reasonable concern to have right now, and you can imagine that you're feeling pretty overwhelmed having to make all these decisions without a partner to lean on.
Yeah.
Is that correct?
Yeah.
Okay. You mentioned you're scared. Is there one thing in particular that's scaring you more than something else right now, or is it just everything?
It's everything. It's being a dad. I mean, there's so much that comes with that. It's that really scares me.
Yeah.
A little bit her ex.
Mm.
He attacked me once. What's gonna make us not do it again? So
Yeah. And you said that he's in jail right now.
yes, he's in jail right now.
Okay. And you don't know when he's getting out.
Correct.
So I can imagine that might create a sense of anxiety or fear. Not knowing when the other shoe's gonna drop, right?
Yeah.
Okay. Do you feel safe at the moment now that he's in jail?
From him, yeah.
Okay.
Yeah.
Obviously, that's not gonna take away all of the stress in your life, but it just makes me feel a little better knowing that you're able to say you feel safe at the moment from him. So I'm glad that you're getting some peace of mind there.
Yeah, I didn't think of it like that.
Yeah. Okay.
One thing I'm not gonna worry about right now.
Alright. So I think it's really important to assess where you're at right now, and just kind of figure out how you're going to handle all of these responsibilities that you didn't ask for as a solo parent.
Mm-hmm.
And I think anxiety is definitely something that I'm hearing you talk a lot about just in the last couple of minutes.
Yeah. It's hard to talk about the anxiety because like I do obviously know what is actually happening, but it's all happening at once, so quickly, nonstop, that I don't know exactly what I'm anxious about. And it's like when I'm not anxious, then I'm just really sad. So it's just constantly like one of those two things in my face. And yeah, it's hard. I don't even get to see my son all the time. I can only go there certain times. So it's like I don't even get to be a parent right now because he's in the hospital.
Wow. Well, do you have anybody in your life that is helping you through this right now? Any support system?
I have some friends. I can't really ask them for too much because I don't even know what I need right now, and my parents don't live here.
Okay.
So, like, I'm in a lot of ways I feel like I'm on my own. I have friends who are like willing to come over and try to distract me, or when the baby comes home they come and babysit, but like I can't ask somebody to just help me babysit, and like I don't know if they're gonna be able to babysit whenever I need them to. And I don't even really need a babysitter right now because I don't have a job. So
Yeah. Okay. Well, I think we need to take it one step at a time. Would you agree with that?
yes.
Okay. I think if we try to focus on all of these issues right now, we're not going to really get anywhere because it's going to be too overwhelming. So I think we can possibly work on your anxiety at the moment.
Okay.
And you also mentioned some sadness that you've been experiencing, which is obviously understandable with everything you're going through. So I think we can maybe go over one of the assessments that you did
Okay.
when you came in today. This one is the shorter one you did. It's called a patient health questionnaire.
Okay.
We call it PHQ 9. So it's 9 questions that kind of assess your headspace over the last 2 weeks. You did score yourself pretty high on a couple of these, so I just want to go over those really quick.
Okay.
Okay. So for feeling down, depressed, or hopeless on a scale of 0 to 3, you scored yourself a 3, which means nearly every day over the last 2 weeks you felt down, depressed, or hopeless. You also scored yourself a 3 on feeling tired or having little energy. And then for the last 3 you gave yourself, it was feeling bad about yourself, or that you are a failure, or you've let yourself or your family down. So those are all pretty heavy feelings to be feeling nearly every day.
Well, I kind of, yeah, I feel like I let my family down. That's the one that kind of hit hardest.
Yeah.
How much of helping my girlfriend is my responsibility? What could I have done more? How did it hurt my kid? It's kind of hard to know how much of that was my responsibility, how much of that was supposed to be me stepping in and protecting her from herself or protecting him from her.
So it sounds like you are feeling some guilt right now about that.
Yeah, you could say guilt.
Okay. Would you call it something different?
No. Yeah, I mean, guilt, failure, I guess it's the same thing.
Okay. Well, like I said, your safety is the most important thing that we should be focused on right now. And that also includes your mental health,
Okay.
right? I want to make sure that you are capable of handling all this stress right now. Because if you don't do anything for yourself right now, I am afraid that it's going to be too overwhelming for you. Do you think that's a fair assessment?
That makes total sense because it's
Okay.
too overwhelming right now.
Yeah, well, I definitely want to help you with that. I think there's a couple things that you and I could do together today that might help with some of this anxiety that you're feeling.
Okay.
Have you ever done any deep breathing techniques?
No.
Okay. Would you like me to explain what they are?
Please.
Okay. So, deep breathing is really relaxing, but one of the main benefits of deep breathing is when you focus and slow down your concentration on your breath, it can actually slow down your heart rate a little bit, which I think will help with the anxiety that you're feeling.
Okay.
Does that sound like something you want to try?
I'll try anything.
Okay. So here's what we'll do. I'm going to demonstrate how to do it, and then I'd like you to join me on the second one,
Okay.
and we'll do 4 all together, and just see how you feel after.
Okay.
So we're going to sit up, nice posture. Keep your hands in a relaxed position on your legs, and you're going to breathe in for a count of 4. We're going to hold it for a count of 4, and then you're going to exhale for a count of 4. Okay. Hold, 2, 3, 4, exhale. You want to try with me now?
Okay.
Okay. Another. And one more. Okay. How do you feel? So I'm gonna see how you feel doing this at home. And when you come back next week, we'll talk about whether it worked or it didn't, and we'll try and figure out something to do if it didn't work the way you hoped. I recommend doing this when you're right in the middle of that most overwhelming feeling, whether it's the anxiety or the sadness or the anger. Um, this kind of technique is more beneficial when you're really in the throes, so to speak, of that emotion.
Okay, that makes sense.
All right. And before you go, I think I just want to tell you how impressed I am with what you shared with me today, how you clearly understand the significance of the situation that you're in and that you're willing to get help. I can imagine that you feel incredibly overwhelmed right now, and it sounds like you are just trying to get through each day as it comes. So the fact that you're willing to come and get therapy right now, I think is a real strength that you should appreciate yourself for.
Thank you.
You're welcome.
It means a lot. Like I said, I don't really have many people right now, so thank you.
Okay. So I will see you next week, and I look forward to hearing how your coping skills worked, okay?
Thank you.
All right. Thank you. Have a good day.
You too.